Good afternoon to all of you. To some, maybe it's good morning. Welcome to today's ECHO session that is focusing on the LabMap experiences. On 13th June 2024, we did share on the same platform regarding the experiences for Malawi and Zimbabwe that looked at the experiences that revolves around data collection and also identifying insights. And having that done, today, we have also brought again an extension, the post-identification of insights and data collection from Mozambique Ministry of Health and also Zimbabwe, the Ministry of Health. So the journey today is you are going to share, the team is going to share how they identified, what kind of thematic areas did they identify from the LabMap data collection, and how far have they gone in terms of implementation? What are their challenges? And how did they institutionalize those findings, those capacity gaps, and also the strategies that they developed to address what data was saying? That's evidence-based decision making. But also, you're also going to hear about how are they monitoring the implementation, and how are they reviewing, and how are they able to navigate the challenges that comes with implementation, and what are the lessons learned? How are they also updating the data to track whether they're making changes or not? So today we have Dr. Pinto, the head of diagnostic department in Mozambique, Minister of Health, supported by Mr. Teixeira Chongo from Mozambique. But we also have Mr. Vincent Champira, the National TB Coordinator from the Ministry of Health, Zimbabwe. And I am Tapson Nyondo, ASLM staff. We'll start with Mozambique presenting, then later Zimbabwe is going to present. Then after that, we're going to open to the public that are here, the participants that are here, so that they can ask questions and find more insights from the team that are presenting. So at this point, I would like to call Dr. Pinto and Team Mozambique to share their presentation. Thank you.
Okay, first of all, I want to thank ASLM to invite us, Mozambique as a country, as a government, to share our experience. And as well, I want to thank Tapson and Francis that also have been with us throughout this journey. And I also want to thank our team. This is the result of the hard work of our team here in Mozambique, led by Isabel and Teixeira. In a glance, we are going to talk about overview of Mozambique, methods and results of LabMap, gap address that we did throughout this journey, and integration process and optimization that we are in a process to adopt, and lessons learned and challenges that we still face in our ecosystem here in Mozambique. And just to remember that we are around 34 going to 35 million inhabitants in Mozambique. Most of them live in the rural areas, and we have a coverage of health facilities in country that cover around 60%, and only 27 approximately percent of health facilities has clinical labs. In our health profile in Mozambique, we adopted recently a new policy where we divide in 3 different systems our national health services, or a national health system, where we have a public sector, private sector, and community sector, where we call subsystems. And currently, Minister of Health oversees mainly public institutions, but we start moving ground to the private, and we are implementing the community systems. And we have administratively, we have divided our country in 11 provinces, and each province has its own districts. We are having currently 162 districts, and we have a network of 1,800 health facilities, and approximately 70 hospitals. And our health system is divided in 4 levels. We have primarily a level that comprises mainly health centers, and we have secondary, tertiary, and quaternary that comprises hospitals from districts to central hospitals. We have 9 general hospitals and 7 provincial hospitals that sits in the same category of attention, and we have district in one side to help health centers and communities, and we have centralized or specialized hospitals to help on those major and complicated cases. And for this intervention regarding on LabMap, we saw in the past and prior webinar where we saw the entire methodology. We are going to only give briefly the topics or points that we saw in this evaluation. That was geographic position of the health facility, consequently the clinical lab, testing capacity, human resource availability, type of lab infrastructure that we have in country, and equipment that we have there, how we do in terms of supply chain, quality management system, connectivity, biosafety, and the sample referral system. And we have the form, how it looked like in terms of data collection. And based on what we saw, we implement this approach through several meetings, virtual meetings with ASLM specialists, and as well in-country meetings, trainings to be able to train the central level team, and as well after training the trainers, go down to the provinces to train our provincial supervisors and their colleagues to be able to generate the data that you are seeing in the screen, where we managed to map 4 centralized labs, clinical labs. I'm talking about clinical labs. We also map public health labs, and as well water and hygiene labs. And we didn't manage to map private labs. And those clinical labs that we mapped was these around 500 labs. Mainly, they are located at health facilities. I'm talking about health centers, and we do have around 66 labs that are located at provincial, general, and district hospitals, and for central hospitals. And the labs covered around 24% of health facilities that we have distributed and spread in country. You know? And something that you can might see, we have seen like a patterns in our map, where we have the major geographic locations here in the map, where we see this is our we call corridors, south corridors. We have center corridor that calls corridor the Beira, and we have the north corridor here that goes from Lixinga one to Zambezia and to Nampula. And we also see a pattern of how we have the population concentrated in the country is also the same that we can see in the map. And we also can see how district hospitals are placed in the map to help navigating and also think in the future when we compare. For instance, if we see Cabo Delgado province is different than Nampula one, the major and populated province, and as well when we look at Zambezia is the second large and populated province, and we compare with that is the third populated province in the country, and we see a different landscape and profile when we see Gaza province, how the facilities and the population are concentrated in one part of the country. And based on what we saw and what we find during this process, we see that our network is not well categorized, is not well structured, is not well mapped according the level, according the service provision, according the how we're going to place equipments, and which kind of service we're going to provide in the end of the day in these health facilities. And the idea is to categorize very well these labs, mainly private labs as well, but also public labs, because we do need to put in process the implementation of our menu of exams, and as well we are developing our essential diagnosis list in country that we're supposed to finish this year. Those guidelines and documents are in progress to be finalized. And we saw that we have a lack of human resource specialized for different areas of inside of lab, and now is not well listed in our human resource unit at the Ministry of Health. It's something that we have to put effort on it to be able to get right personnel in a right position in the right places in country. And consequently, we have a few accredited labs in country. We have recently accredited 5 clinical labs in Mozambique. Most of the labs accredited before these 5 labs were public health labs and private labs. And we are facing a huge setbacks in terms of infrastructure. We have a lack of space. First of all, there are a lot of labs that are working in an inadequate place. We don't have in many labs a warehouse to stock most of the lab products. We don't have a good infrastructure to be able to provide a great condition in terms of safety, biosafety, and security. We do have a lack of water supply and electricity that contribute enormously to our performance, and also to our preparedness for a pandemic in case of need. That's why we have to strengthen our management process in terms of upgrade infrastructure. We are ongoing process to update our guideline. We have to ensure by safety through the Global Fund. We managed to purchase biosafety cabinets to deliver at provincial district hospital to manage and also to process pathogens. And as well, we need to improve in terms of calibration and maintenance center. We started a process of assessment and training. We did a training in our maintenance staff and provide them a couple of kits. But we are ongoing process to develop a roadmap to establish a center of excellency in terms of maintenance in country, with help of our stakeholders and the Global Fund as well. This slide is only to show that we have included recently 5 labs, a part of others that we have in country, clinical labs mainly. They approved, we are in a process to give them the certification. And based on all the results that we showed, we had presented these in our different meetings at the Ministry of Health. We have our directorate, our board, and in our department to incorporate the findings of LabMap in our strategic plan. We are going to draft a 10-year strategic plan, and we also use this to optimize the network, the entire network, especially the molecular network based on point of care TB. And based on that, we assess our TB network to see if our point of care PCR TB equipments, Gene Expert and others are on great use or not. We saw that major equipments still have room of improvement, because we have an excess of tests to be done, and those that reach the limit are few of them, and there are places that we still have such a shortage of availability. Those we can cover through sample referral system, and to reach this performance, we end up evaluating based on the targets of the country to get tested at least 600 people, at least 50 patients per month. And this gave us an understanding how we are performing, because we have a network of 175 labs and more than 230 equipments that serves directly more than 200,000 inhabitants. And the idea is to optimize these areas, not only deploying equipments, but putting them in a maximum utilization as possible through sample referral system, and also integration of testing in our network as well. And we have different scenarios where we're going to develop that based on the gaps that we saw inside of remote areas of Maputo province and Nampula province as well. The idea is to increase only 28 gene expert equipments, not more than that, as we assumed in the beginning. We was thinking about more than 70 equipments, but we end up seeing that we need less than that, and also optimize the modules, how we are utilizing those modules, and the amount of modules that we can integrate to other diseases. We're talking about COVID, HIV, viral load, hepatitis, and other pathogens that might interest the public health unit, and as well the clinical sites. And this was one of the major findings and major gains that we had during this process. And the other optimization, we end up creating different strategies as to optimize our menu list, and also develop our essential diagnosis list through the findings that we are seeing, and prioritize based on level of attention where those tests goes, and equipments, and which volume output of equipment we're going to be placed in tertiary level, quaternary level, and secondary level. And as well, it's important to map our private labs and education or teaching labs to know where we're going to categorize all these labs, and we have to code all the public health laboratories that we already on process to do all of these. We end up regularly and timely assess this information to get on track. My final slide will be the lessons learned and challenges that we are facing. Throughout the process, we saw different stages of the process: the management process, human resources, data collection, health facility assessment, and data cleaning and analysis. We had a good experiencing engage the private labs in Maputo City, and colleagues from our National Health Institute and our public health directorate in this process, and was a good engagement at high level. And also within our human resource at central level and provincial level, the provincial supervisors were so passionate and adopt so easily and engage themselves into the activity, and the tool that we train them to implement and collect data, they find easy to collect data and update data and correct those that were not collected appropriately. And one of the things that we also saw was the variability of the landscape of health facility. Even those health facilities at the same level of attention, they were so variable, and was interesting and impressed how they are variable, and which are the challenges that we're going to face in the future. And also the data cleaning was a bit challenging for most of us, and the analysis as well, that we have to engage and also learn how to in country be able to do this kind of assessment, this kind of analysis for the future assessments that we have planned. And this was good because it's a key instrument to inform our national strategic plan for the next cycle. We managed to optimize the molecular diagnosed approach, and we also applied the same tool to see the accuracy of our DNO DNA assessment that we carried out in the past month. And this will be important to generate the location of the labs, and also see in the future, when we're going to have a need to engage the entire network, which labs we're going to count on it, from the private to academic till the public health laboratories, and also clinical laboratories. And thank you all. Just for you to see, we have those big and interesting labs, but we have areas where we have some health facilities at rural areas that don't have space. They work on these type of labs, and there are other labs that, because of lack of space, they have to put things like on top of bin, or put together many equipments at the same bench. And also the lack of stock house. We do have some products that are stocked in not appropriate way. It's something that we have to work on it. And when we're going to standardize the lab infrastructure, we going to give these directions to the provinces and the districts, how they have to improve in the near future. Thank you, Tapson. These were my presentation. Over.
Thank you very much, Dr. Pinto, for the wonderful presentation. Participants, you can keep on asking questions in the chat box, and Team Mozambique, some of them will be answered directly, but others will ask them to respond. So at this point, I would like to invite Mr. Vincent Champira from Zimbabwe, the Minister of Health, to share their experiences. Thank you.
Okay, thank you, Tapson. So colleagues, what you see is the laboratory mapping team from Zimbabwe. During the time we conducted the laboratory mapping exercise. So I'll be talking about the thematic areas identified. Tapson, confirm if my screen is okay, if my slide is okay?
Yes, we're able to see.
Yes.
Okay. So I'll discuss on the thematic areas identified, institutionalization and integration, implementation, experiences and updates, updating of the data set, monitoring and review, lessons learned, and the best practices. So what you're seeing is the tiered system, or the tiered network in Zimbabwe. We have a 5-tiered system, and from that we have primary healthcare centers, district and mission hospital laboratories, provincial hospital laboratories, central hospital labs, and reference labs. And of those, we have 3 reference labs, 10 provincial hospital labs, 5 central hospital labs, 102 mission and district hospital labs, and then 112 primary healthcare labs, to give us a total of 232 public health labs in Zimbabwe. This is an image to show the labs that we mapped in January 2023, and during that exercise we mapped a total of 266 laboratories. This included public and private laboratories. In terms of the thematic areas identified from the lab mapping exercise, And also Zimbabwe went through the laboratory network assessment, which also gave some thematic areas. So just to mention a few, there were issues to do with calibration of equipment within the tiered system or within the diagnostic network, variation of testing menu within tiers and across the tiers, the non-aligned tiers within Ministry of Health public labs versus the private labs, the animal health labs, as well as the environmental health labs. The way the tiered structure is appearing, like I've shown in the previous slides, was not matching with the private animal and environmental health labs. Accreditation of provincial and central level labs, biosafety level 3 laboratories, which have the capacity to handle dangerous and priority pathogens, few facilities offering drug resistance monitoring services in the country. And then from the LabMap assessment, issues to do with molecular microbiology capacity, national policy and plans. This speaks to the National Laboratory Strategic Plan, as well as the laboratory policy, site capacity plans, laboratory data unit. This speaks to data sharing and analysis within the laboratory network, issues to do with equipment maintenance, 17043 accreditation. This speaks to labs having the capacity to provide proficiency testing panels for the network, biosafety and biosecurity issues, not forgetting laboratory workforce, as well as supply chain management issues and in vitro diagnostics. So in terms of institutionalization and integration, after the extensive data cleaning and analysis, we prepared an operational plan. And this operational plan was presented to the Director, Laboratory Services for adoption. All findings and recommendations will be channeled through the Director, and action items were assigned to LabNet team as applicable. The DLS and LabNet team are working closely to start driving the implementation of the recommendations. So within DLS, which is the Directorate of Laboratory Services, we have a set of coordinators who were assigned specific tasks with respect to the operational plans. And as we speak, it's work in progress to address those key issues identified. We presented the LabNet assessment findings to the Laboratory Technical Working Group, and from there, an operational plan was developed. Also, the lab mapping operational plan was also presented to the Lab TWG. And some identified thematic areas are also to be incorporated in the National Laboratory Strategic Plan, which is set for review early 2025. And some thematic areas also identified from the LabNet include the establishment of the laboratory data unit within the Directorate of Laboratory Services, revision of the strategic plan to include the One Health concept, and also issues to do with specimen storage and biobanking capacity within the diagnostic network. So in terms of the experiences, what you see in your screens are a set of the identified gaps And from the lab mapping operational plan, there were 16 key identified issues, and to date, 7 of them are being addressed, and the other ones, we are still to start on them, giving us around 44% of implementation. The other ones that have not started yet, it's not like they're at zero, but there are some constraints and some processes which have already started. There was an issue of establishing a calibration unit within the country, which is accredited in 17025 standard. And currently, I'm pleased to say the calibration center setup was complete at the National Microbiology Reference Laboratory. The center is now working towards achieving accreditation in 17025 standard. And once that is achieved, the center will provide calibration services to all the public health laboratories in the diagnostic network. And we are still working in progress to expand that to the animal health labs as well as the environmental health labs. Another gap was on the provincial and central level laboratories achieving accreditation or national certification. And currently, the national certification audits are underway in the country, and all central hospital labs have been enrolled. And to date, I'm pleased to say that all the provincial labs we have in the country achieved accreditation, and some of them are going through surveillance audits through SATCAS for the new standard, which is ISO 15189 of 2022. There was an issue of limited access or availability of BSL-3 laboratories. And to date, we have 2 BSL-3 labs in Zimbabwe. These are containerized laboratories that were procured with support from UNTP and WHO. And currently, the TB reference lab in Bulawayo is under renovations, and the project is expected to be completed by mid-November, and that would be another addition to the number of biosafety level 3 laboratories in the country. There was an issue of lack of certified biological safety cabinets in some of the labs. We engaged the service provider and they revised their processes, and they are now providing service and certification of all the biosafety cabinets within the diagnostic network that are covered under the service contract within the National TB Program. There were issues to do with incomplete waste management protocols. Guidelines were prepared and updated, and construction of incinerators is still in progress, as this was a gap identified also from lab mapping and other in-country assessments. The usage of LIMS, which is the Laboratory Information Management System, was not covering all departments within the lab. Currently, or during the mapping exercise, when we did the analysis, it was mainly limited to HIV, TB, and COVID-19. And the recommendation was to include all lab departments for effective data tracking and management. We conducted a LIMS superuser training in the country, and facilities have begun upgrading to include other tests in the LIMS. Remember, systems can be developed or can be improved better by the users. And we encouraged laboratories to communicate with our IT team so that they can start adding tests within their test menu at the respective tiers within the diagnostic network. And the results so far are impressive, as approximately 30% of the labs have added at least 3 more tests to their testing menu that they are capturing within the laboratory information management system. And we have one system that we use in the country across the public health labs. And we are also working to increase the coverage and installation of LIMS to all the public health labs. Another gap was on genomic sequencing capability, which was limited to priority pathogens like SARS-CoV-2 and cholera. And currently, I'm pleased to say we have the MySeq platform available at the National Microbiology Reference Lab. And we have a Sanger sequencer, which is for HIV-DR drug resistance sequencing. It's under procurement through support from the Global Fund. The National Microbiology Reference Lab also received training on bacterial sequencing, and they also decentralized training to one of our lab in Bulawayo on sequencing COVID-19. And in the country, we have the TB drug resistance survey, which is underway. The pilot was started last week, and in-country trainings will be done on TB sequencing. In terms of updating the lab mapping data set, in January 2023, like I said before, we mapped 266 labs and 115 labs were public health labs. We improved one of the processes, one of the activities within the TB program, which is the TB external quality assurance, and we used Cobra Toolbox. And as we were doing our TB EQA on a quarterly basis, we collected geo-coordinates on some of the labs that were unmapped from the lab mapping dataset. We also engaged chief laboratory scientists in our provinces to further update our list of public health labs, as this was also another gap that we identified during the lab mapping data analysis. We managed to merge that document with the lab mapping dataset and the COBO EQA dataset to have coordinates on the public health labs. Like I said before, we have 232 labs. As of January 2023, 50% of those labs were mapped. And to date, with the COBO innovation, we have mapped up to 78% of the public health labs. And to that effect, we have 50 labs remaining to be mapped because they were not covered under the TB EQA. However, as a country, we are working on a self-assessment tool to map the remaining labs. And in terms of monitoring and review, what you see is a snapshot of an operational plan that was developed from the LabNet assessment. It is also in the same format in terms of the operational plan for the laboratory mapping. And we do have monthly meetings within DLS, within the Directorate of Lab Services. And remember, I said the set of coordinators were assigned specific tasks to work on. And within those meetings, we deliberate on the progress of implementation. This is just a snapshot of the operational plan. It's quite a big document, quite comprehensive, and I would like to say it is a living document where each and every one have their responsibilities and update on a monthly basis. In terms of lessons learned and best practices, Operational plans are constantly discussed in updates given during the DLS meetings. Previously, we had the DNO done and we have the report, and DLS is working to do another comprehensive DNO with all relevant stakeholders using PlanWise, thanks to ASLM in providing training to PlanWise. And the previous presentation actually showed usage of PlanWise as they performed their DNO. And we've learned that DNO gives better results when everyone is involved. We have seen that also leveraging on existing funding and programs can help address identified gaps and bring better outcomes. For example, in our TB EQA, and currently teams are already in the field collecting data, and it's also electronic, and this is also helping in terms of having electronic reports in real time. Comparing the heat map from the lab mapping analysis and the country priority diseases, we could see that there are some gaps. Testing capacity on some of the country priority diseases was not evaluated during the last lab mapping exercise. And as a country, we are working on addressing that gap through a self-assessment using a revised tool. This is still work in progress, and we'll be working together with ASLM team. In terms of the challenges, main challenges are related to funding, funding gaps for procurement of critical equipment, and also in terms of funding gaps for capacity building in genomic sequencing for all the reference labs. And lastly, some delays in implementation of some important projects, especially the construction of high-level incinerators. Thank you, ladies and gentlemen, for listening. Never stop encouraging your team.
Thank you very much, Vincent and Dr. Pinto, for the presentation. As you can see, this is a journey that is continuous from data collection, but it gets more exciting when you start diving into the insights that LabMap, but also you have also seen the addition, the LabNet, which is complementary to the LabMap. But you have also seen how best do you increase coverage, and plan-wise of operation accessibility is very critical to ensure that it's evidence-based and is showing you where to go. At this point, there are questions in the chat. And the first one, before we open the floor, the first one is to Dr. Pinto. Please, the data analysis challenges you experience, what data collection tools do you use? Are they available, and can you share? There is also another question that goes to, I think, Teixeira tried to answer on that. But there's also another question from Edwin that talks about lab mapping at times is costly, more so if this involved physical travel to the facilities. Are there plans for periodic update of the data collected? If yes, do you plan to achieve this? I think some of these have been answered by Vincent and the team, but I'll leave it to Dr. Pinto and Vincent to respond to that. Thank you. Over to you, Dr. Pinto, then Vincent.
Okay. Thank you for the questions. And yes, we do have tools. We are using the tools provided by the ASLM, and it's a package that we use to assess that. But my main focus is on LabMap. As Dr. Vincent commented, it's important to have a clear geo position of the labs first, and we have to update as soon as possible all labs according to the level. The second thing that is important is not to let the data get out of date. We have to upgrade periodically. Our intention is to periodically update the data of the labs, mainly because we're going to propose a strategic plan. And based on the strategic plan, it's important to see how the lab network evolve throughout the time. That's why it's important to keep on track that. I did not mention one thing that is important as well, is to overlap the lab network that we have mapped, no? And as well with the sample referral system. In Mozambique, we have a sample referral system that cover 157 districts and the entire health facilities to transfer clinical samples, and also public related samples from remote areas to the destination lab to be tested. It's important also to overlap DNO DNA LabMap sample referral system infrastructure or health facility coverage to see how it's possible to optimize the network. And it's important as well to update the network, update the lab capacity, infrastructure, electricity, and also many of the tests, and as well try to develop or strengthen all these with the essential diagnosis list that we must have in each country. Over to you, Tapson.
Thank you, Dr. Pinto. Vincent, before you answer on how sustaining the updating, there's also a question on data interoperability. What governance arrangements do we have in place for that? So you can tackle both questions from your side. Over to you, Vincent.
Thank you, Tapson, and thank you, listeners, for the nice comments. In terms of governance arrangements in place, like I said, the most critical part is involving the directorate in these findings, because if there is adoption and recognition from the directorate, it means we have the biggest support, and from there, as a team, we are now able to implement the corrective actions or the recommendations, because there are some issues which require direction from the directorate, and also in terms of maneuvering within the systems. So the key point is to have adoption and commitment from the highest level of management within the laboratory network. And Zimbabwe as a country, that was the first priority, whereby these operational plans from LabNet and lab mapping were presented to the Director of Laboratory Services, and we have monthly meetings where we deliberate in terms of the progress. And it is good when you have commitment from management, implementation is made much easier. In terms of periodic updating, there is need to use inexpensive tools like Kobo, even ODK. These are inexpensive tools whereby countries can use them, because funding for continuous mapping may not be readily available, especially for countries that were supported and did some part of the mapping. And we can all agree that the funding can never be sufficient to map all the laboratories. So there's now need to make use of some innovations and also integrating with existing programs. I can say within countries, there are activities that are funded either by Global Fund or other implementing partners in specific countries. We could make use of these data collection tools, COBO, ODK, EpiCollect 5. These are free, inexpensive tools whereby countries can use and collect data. And as they are collecting the data, do not forget to add the geo-coordinates because they become very important when it comes to performing diagnostic network optimization. And speaking to the other comment in terms of the data analysis challenges that we experienced, I would like to thank Capson and the ASLM team as they assisted Zimbabwe in terms of doing the data analysis, cleaning the data, and then performing some descriptive and bivariate analysis to show the outcomes of the country. In terms of doing multivariate analysis, we have not yet started there as we mainly focused on improving the data set so that when it comes to performing multivariate, we are going to bring meaningful relationships. Thank you.
Thank you, Vincent. We're running out of time, but just to a repeat question that talks about how can we access. Actually, the tool is on website and it can be accessed by anyone that wishes to. If you just push the survey tool about a mapping SLM, you should be able to see the tool online, and I was able to access. Just to add some few points. Yes, it's true, learning LabMap is expensive, but it also adds value to the process in terms of evidence-based planning. However, as Vincent mentioned and Dr. Pinto, there are also initiatives to move towards self-assessment, but also remote trainings to ensure that the program is sustainable, but it's also able to give insights that the countries need to support their program and ensure that their laboratory strategic plans are based on the evidence that generated from the system. But also, when you look at the countries, there are various sources of information, and we have been mapping that information to make sure that when they're monitoring to see based on the KPI, they should be able to use the existing information mapped to the LabMap tool. That should be able to help in terms of reducing the costs, but providing the necessary value and insights that they need to monitor whether implementation is changing. So at this point, we are at the top of the hour. I would like to thank everyone for attending this meeting, especially Team Mozambique for a wonderful job, but also Team Zimbabwe for accepting to share your insights, your findings, and your journey. And we want to wish you all the best as you continue implementing, but also they need technical support and financial resources to ensure that they actualize what they planned. Thank you very much and have a good day. Thank you.